Hello, I'm Ken Farr. Grab a tea or coffee and join me now for this week's Baton Rouge Press Club Highlights Report.
The good news that I have is we have an effective vaccine to avoid all of that. And so it need not be that we have to have as many people as we currently have nationwide with this current measles outbreak. And we've had an effective vaccine since 1963, and really over time, the vaccine has continued to improve and only gotten better. And it is now part of a series of other illnesses that we also vaccinate against. Classically for measles, we lump together measles with mumps and rubella. And those are also potentially very serious infections that we've also been able to really manage effectively through vaccines. So as a result of that very effective vaccine, improved vaccine over time, significant scientific study, public health efforts, and policy work, we actually as a nation were able to achieve elimination of measles in this nation in the year 2000. And it's a huge accomplishment, again, of really multiple swaths of society. But unfortunately now I stand before you talking about an outbreak of more than 700 people in this nation, affecting more than 22 states. And so I think one of the reasons you have me here is to talk about, well, why is that the case? If we can say in 2000 we eliminated, why are we here? You know, the last major outbreak that we had of measles that's anywhere comparable to this was in 1994, when we had an outbreak of about 963 individuals, and that was 6 years before we went on to actually eliminate the disease in the United States, at least the endemic. According to the Centers for Disease Control and Prevention, the current outbreak seems to have been measles introduced from countries where they're having their own challenges with outbreaks, specifically Israel, Ukraine, and the Philippines. That's not new, actually. We have continued to have imported measles really since the elimination. In fact, in the year that we eliminated measles in 2000, 60 cases actually happened in that year, but they were all importations from external sources. And so the key challenge right now is that measles is actually growing internationally. So those countries that I mentioned, Israel, Ukraine, Philippines, all have their own pretty severe measles outbreaks that are taking place. And actually more broadly, we're seeing measles globally on the rise. But really, that hasn't had an impact in the United States until recently. And so the question is, what's different? Why now, even though we've had importation of measles every year since elimination, and even during the year of elimination, do we now have this severe outbreak in the United States? And put simply, we're behind the 8 ball on protecting ourselves. The things that allowed us to achieve elimination in the year 2000, effective vaccination early in childhood, really broad coverage of the populations that we need to be reaching, which is everybody, have been slowly eroded over the last 2 decades with growing concerns about vaccines. There's always been general concerns about vaccines, and I'd say just as a primary care physician, there's always concerns about sort of any new treatment or any established treatment from a small subset of folks who may question Western medicine or methodologies or wonder what are the motivations for physicians. But this particular movement has been different than that general trend. Really, it had its birth in around 1998. There was a very famous study done by a physician in the United Kingdom whose name is Andrew Wakefield. The study has since been retracted because of poor scientific methodology, questionable motives, and just scientific soundness. And Dr. Wakefield is no longer Dr. Wakefield and actually has had his medical license revoked by the United Kingdom authorities, all because of this initial study linking the measles, mumps, and rubella vaccine to autism. Has been very soundly debunked, and essentially they've raised concerns about the methods that Dr. Wakefield had used and Mr. Wakefield had used to really start a concerned movement around the link between autism and measles. Before I go any further, I just want to emphasize and just put a very fine point on it. There is not now, nor has there ever been, a legitimate link between MMR, the measles, mumps, and rubella vaccine, or any vaccination, and autism.
Join us every Tuesday for the Baton Rouge Press Club Highlights Report. And I will see you next time right here on NewsNet, Baton Rouge.